There's a condition that affects many teenage boys.
Yeah, other kids would often notice and they'd tease me about it.
It's a condition that most guys who have it do their best to hide it.
Yeah, I was so scared of being teased that I layered my shirt so much that, I would wear 3 inches of layers from my actual chest.
And I play basketball, so I'd always put on a tight undershirt above, under a baggy t-shirt.
Or at all costs avoided going to the beach or anything that involved taking off my shirt,
That's because they had deposits of tissue on their chest that made it look like they were developing breasts.
Tissue would form on breast area, so it would protrude right here a bit, and it'd be very noticeable.
It was just my chest was really large, and it wasn't a normal boy, it was, I could tell it was kind of girl-like.
It's surprisingly common. As many as 1 out of 3 teen guys may have excess breast tissue.
Well, it definitely brings your self-confidence down. A lot of things you would have done that you don't do anymore.
I was pretty bummed out, depressed. It was just kind of really weird because I really kind of affected dating or social-wise. I didn't really want to hang out with the other boys because I just was scared that they would notice.
Dr. Elliot Jacobs is a plastic surgeon in New York City. He specializes in dealing with this condition. Hi, doctor.
Hi, how you doing?
Fine, thank you. So what exactly are we talking about?
Well, we're concerned about the growth of extra tissue on a young boy's chest, which sometimes can get big enough to resemble a female breast. It's called gynecomastia, which technically means female breast on a young man.
Doctor, what causes it?
We don't know for sure what causes it, although we do know that there is a hereditary component, and there is also known as a hormone imbalance as well, and these 2 things contribute to the growth.
Does it go away on its own?
In many circumstances, it will go away by itself, but in about 1 out of every 3 young men, it will remain for more than 2 years, and once it does, it tends to stay forever.
So does that mean this is something that a guy has to live with for the rest of his life?
Absolutely not. There are unfortunately no good treatments for it to remove it easily, such as with pills or injections. There is an alternative, which is surgery. The surgery itself can target the extra tissue, physically remove it from the body, and provide a nice, normal-appearing masculine chest for a young man.
Doctor, a common surgery for girls is getting a nose job, and most doctors recommend that girls wait until they are at least 18 years old before considering cosmetic surgery. Is that true with this condition for boys as well?
Not true. You see, when you consider somebody for a nose job, we want to wait until they are physically mature, and that usually occurs around 18. But for this condition in young men, and it usually starts around age 12 or 13, they can't wait till they're 18 because they're going to be embarrassed during their entire teenage years. And if we remove it in the early stage, they will have a nice normal chest forever.
So you're saying that it won't come back if they have surgery?
That is correct. I've done about 250 young men so far. Not one of them has had what we call a recurrence. It hasn't regrown after the surgery was done.
So, if a teen feels he has this problem, what should he do?
I think the first thing a teenager should do is speak to your parents. Speak to them, tell them about the problem. They may not even know about it. They may not even have heard about the condition. And then the parents and you should go to a doctor, have it checked out, and then follow the doctor's advice, who may say, wait it out, let's watch it for a while, or if it's been there for a while, you may want to consider surgery.
Well, doctor, thank you very much for discussing this with us.
You're most welcome. It's been my pleasure.
Dr. Jacobs was kind enough to arrange for us to talk with some of his former patients. At the start of this report, we heard them describing what it was like to live with this condition. They all had the surgery. Here's their comments on life now.
I'm more social now. I'm not ashamed to take it off my shirt in the gym, I actually go to the gym now. I used to avoid it at all costs. I mean, I'm planning to go to the beach this summer for the first time in a long time and swim, you know. So it's pretty exciting and definitely a whole new lease on life.
Well, basketball season's going strong and I don't have to be nervous about wearing a uniform. I feel great. Beforehand, I'd constantly have to, you know, be careful, but now I can live life completely normal.
So, if you have male breast tissue and it's causing you distress, don't keep it a secret. Talk to your parents, and you may want to consult a specialist like Dr. Jacobs. So if you'd like to find out more about this, there's a link on our website.